Welcome to the One Piece Implant Mentor podcast. I'm Dr. Andrea Joy Smith, your host and mentor. The One Piece Implant Mentor podcast is your firsthand look into the world of one piece dental implantology. This podcast introduces you to dentists who are successfully placing one piece implants to stabilize dentures and much, much more. My next guest is a diplomat and the president of the International Academy of Many Dental Implants. She has also been awarded a mastership in the International Congress of Oral Implantologists, ICOI, and she is a member of the American Academy of Implant Dentistry, the AAID. Dr. Diana Rodriguez has been practicing dentistry since 2004. Her private practice journey likely has a blueprint or pattern similar to how many of us got started. We graduate dental school, equipped to drill and fill, and at some point, we hang our own shingle and we wait for the patients to come calling. Here with us today on the podcast to teach us how she changed that blueprint for her practice with one-piece dental implants. Please welcome Dr. Diana Rodriguez. Diana, welcome to the podcast.
Thank you, Dr. Smith. Thank you for having me.
The goal of this podcast is to advance the paradigm of many dental implants. To that end, I want to let our listeners know that offering a procedure like one-piece dental implants can transform the lives of their patients and their dental practices. The private practice blueprint I mentioned earlier, it doesn't always result in an ultra successful practice. And Diana, I know what a great clinician you are. But did your first few years in private practice yield the type of success that you dreamed of?
So my first few years most definitely did not yield the success that I envisioned for myself as a practicing dentist. Mm-hmm. For 8 years, I worked as an associate at several different practices. Some positions I enjoyed more than others. But I have to say that there were definitely many times where I felt maybe I made a mistake going into dentistry. Financially, I struggled from time to time. There were some practices that I was in that I just didn't feel like I was doing rewarding procedures. I didn't feel appreciated. And I just kept going, tried to take continuing ed courses, try to broaden my skill set. I kept looking for a practice to buy, never really finding the practice that I thought was worth buying. And then finally, after 8 years working as an associate, I decided to start from scratch and hopefully build that practice and that life that I had envisioned for myself.
Well, very good. Some of us struggle early on, not really knowing if we made the right decision because there are financial struggles. Can you describe for us what your annual collections were like right when you started your practice?
So when I started my practice, I started from scratch. My parents had space that they had rented out to a medical doctor. So eventually I got my hands on that space and I equipped 2 operatories, signed up with as many insurance companies as I could. I had a website, a very basic one. But it was a very slow process in the beginning. And I would say it was in the low couple $100,000.
Now, can you describe the success of your practice collections-wise after implementing these one-piece dental implants?
I would say that I started placing one-piece implants in 2014. Mm-hmm. And I have grown my collections, I would say anywhere. I was at the point where I was tired of doing the operative and some endo and some crowns. And really what drove me to take more continuing education courses in implantology was my patients. Okay. I was referring them to the oral surgeon or the periodontist to have an implant placed. And my patients kept telling me, why can't you do it? I don't want to go to another office. Why can't you do it? And I kept hearing this over and over again. And I said to myself, I really have to find a course that's geared for the general dentist that's going to teach me how I can not only perform the surgical portion, but also the restorative portion. So I kept looking for courses, kept taking courses, and eventually I came across Shack and First in Buffalo, New York, and I just started going to as many courses as I could. They offer courses on a monthly basis, and for those first 2 years, I was up there as often as I could. If not, I was online watching videos of different surgeries. It was just a constant self-education process.
How difficult was it to implement once you decided to get started?
What I did was I started thinking about patients in my office that needed this procedure. I started selecting cases that I thought would be straightforward, patients that I felt, comfortable working on, just in case maybe something went south. I knew these patients were not going to give me a hard time. And I started selecting these patients and planning their cases. I bought the armamentarium that I needed, which was, I would say, affordable. I think I spent initially somewhere between $10,000 and $13,000 to buy everything that I needed just to get started, and slowly got wanted to have the procedure done, and they wanted not to have to go elsewhere.
I hear that a lot. Often patients don't want to be referred. They want you to do everything. So that is actually a good thing for us, because when we learn a skill as valuable as we have with one piece implants, that's certainly something that we can do. You mentioned the startup cost. How many cases did it take you to recoup that $10,000 to $13,000 in startup cost?
Not many. I think it was probably 2 cases.
Wow, that's great. And again, that's very rare for anything that we want to invest in. Was it difficult to get your staff on board? How large was your staff at that time?
I had 3 staff members at that point.
And were they on board with you offering this procedure? Were they excited about it? Was it difficult for them to learn to help you implement this procedure?
No, my staff was definitely open to the procedure. They were curious. They were wanting to learn something new. They saw that the setup was fairly simple. This was not going to be an elaborate setup. They were very supportive of this new procedure.
I found that to be the case also, because it is a simpler procedure. Can you describe your typical patient that needs denture stabilization or any other full mouth reconstruction work that you do?
I love doing denture stabilization. These patients that come to us with a poorly fitting lower denture or even an upper denture, I know that they are going to be happy. We get a lot of lower overdenture patients. They come in because they can't eat, they can't chew, they don't want to go out to eat with their family. And a lot of times they have not been educated. They have no idea that this is an option. We do a lot of marketing on TV, so that's how most of our patients find us. And it's just a great procedure. And those patients are probably my happiest patients.
That is great. I was going to mention marketing. Did you always do television, or did you start with some other forms of marketing before television?
So initially it was mailers and our website. And then slowly as our collections grew, it probably was 2 or 3 years before we started advertising on TV.
I found that television trumps everything. Is that your experience as well?
It definitely does. As the saying goes, an educated consumer is the best customer. And I would say that is 100% true. Those patients that come in after having watched an infomercial, a 30-minute segment on one piece implants, or however they see us on TV, they have some education on the procedure. And then oftentimes what they do is they then go onto our website or our YouTube channel, learn more. So when they come in, they already know so much about the procedure. They just want to proceed.
And they've watched you on YouTube. They feel like they know you. They really feel like they're going to get something that they've actually been waiting for. A lot of these patients have stayed away from the dentist for a long time because there hasn't been any real solution for them. So congratulations on that successful implementation on this service that many, many patients can benefit from.
Thank you.
And lastly, I want to ask you, what advice would you give to dentists who are looking for something to take their practice to the next level, What advice would you give them if they're hesitant to start this one-piece implant journey?
I would tell them to start taking as many courses as they can. I would tell them to find a mentor. And if it's possible for them to observe the mentor chairside, that is extremely invaluable. I would just tell them start with straightforward cases. Don't pick any cases that look like this may or may not work. You want to start with straightforward cases with patients that you feel very comfortable working on. And I think the sky is the limit.
That is really good sound advice. I too believe like you that the sky is the limit and that the future for one-piece implants in general is very, very bright. So thank you for sharing your insights and letting doctors all over the world know that when you introduce one simple procedure into your office, it can not only change your life, but also the life of your practice. And thanks to everyone who listened to this episode. I certainly know that Diana's story is very inspiring, and hopefully you've learned and heard something that will inspire you to start this journey in one-piece dental implantology. Good night.
Good night.